Yep, sorry, my I'm guessing I'm gonna have to set up a noise gate on Discord. Push to talk isn't working anymore. My yeah, gotta get out of my gamer habits. How you doing, man?
Doing all right, doing all right. It's been a while. Good
Yeah,
to,
it's been a minute. I think last time we talked one on one, or not one on one, but yeah, spoke was like on a Prime Econ panel or something.
yeah, I did a couple of those. And then I just had a kid and then kind of swore off panels for a while. What is his handle? It's in the title. Spectre0TV.
Yeah, I would I don't know. I think I've seen a little bit of like Freems coming back and doing a couple of panels. I really liked those, but the other ones that are on this platform, I can definitely understand aren't everybody's cup of tea. So don't blame you there.
Yeah, it just there's a combination of it getting like very much the same um uh, like and even then uh it just got so friggin' toxic. Yeah, it was a personal choice more than anything. Who's making whom uncomfortable also frames who. Mr. Printed.
Oh my god. Yeah,
uh,
no, there have been times where I've had to step away and take a break, so I get what you're talking about with the toxicity more than you probably think. Trust
yeah,
me.
I've
It's
always preferred
yeah.
one-on-ones more than anything anyways, so this is perfect. If this was
Yeah.
something that I thought was going to get like more heated, I would want a moderator. But like, yeah, I think this should be because generally we agree on a lot of stuff. Last I knew, you're still more left leaning, probably more left than me. I think you're still syndicalist, right?
All right, got that fixed. No, actually, I would, if I had to label myself, I guess I'd call myself like a Marxist or like a revisionist Marxist. I don't think like syndicalism is probably a goal that's worth shooting for because,
Mm-hmm.
yeah, I don't think like the road there is necessarily going to lead to the best outcomes in my lifetime. I'm more interested in like what can we do to improve like the material conditions of the working class. Maybe that's not overthrowing capitalism. Maybe it is take it, step by step, day by day, policy by policy.
Mm-hmm. Yeah, so we're pretty similar, honestly, because I just say generally I'm a socialist. There's some issues that I have with some things regarding socialism, like private ownership and stuff like that. But uh, and I'm when I say that, I don't mean like homes and stuff. I mean like more so in the arts. Um, but like yeah, I think we're relatively similar, and that stuff could be a conversation for another day. But point being, you know, you're not a right winger. You're not going to be arguing in favor of the healthcare system that we have now. You're going to admit the faults of it. Um, so that could really help guide the conversation in a more productive way. Honestly.
Yeah, I mean, obviously, the ideal situation would be that the country didn't spend the last 40 years like gutting the funding from our hospitals, so that like we had a limited amount of beds in the first place and didn't even have to like entertain these kind of conversations.
I mean, either way, there we're going to be a limited amount of beds, but the amount of beds that we do have and the way that we have them is exactly that. Especially the way that we've gutted specifically the public sector healthcare. But yeah, I totally agree with that. Just like a couple of nuanced things. So, what do you remember about my experience in healthcare?
I remember, I believe you were a nurse.
No.
Was it a trauma nurse, or am I just like way off in my memory? It's been a long year.
Uh,
To be very honest with you.
yeah, everyone makes that mistake, and I'm always quick to correct them because I don't want them to overqualify me. Currently, I'm studying to be a nurse. I'm on my third attempt. Uh, this one is pretty likely because the state is paying for it. One of the few things I can thank Big Gretch for. Um, but I was a CNA for 6 years. Knee injury took me out of that. I worked in hospice. I took schooling for medical billing and office administration. I've worked as a medical biller off and on for the past almost 15 years. Jesus fucking Christ. God, what, 2010, 11 years. And basically, I've worked on the provider side and the administrative side off and on over the course of the past 10, 11, 12 years. So I'm pretty. I picked up a lot of information over that time, while also knowing a lot about like the insurance side of things and understanding things like HIPAA and patient rights and various things like that. And I have due to my work in hospice, I have a pretty good understanding of like DNR and do not resuscitate orders. If I get too clinical, just ask me to explain some terms, because like there's a lot of shorthand that I still use, even though I'm not directly in that anymore. So I have no problem explaining it.
Right on. Yeah, I will probably have to stop and ask a few questions, as I'm not as well read on a lot of this issue. But just to make sure I'm understanding, when you say medical biller, like I used to work in substance abuse treatment and rehabs, right? So like this would be the person whose job it is on like the hospital side, I suppose, to negotiate with the insurance company, and on the other side to negotiate like with the with the hospital, or what does that look like? On, you said you've been on both sides of it.
I haven't been on the insurance side, just both sides of the healthcare system as is, like provider and clinical and administrative is basically what I'm saying, because that's like the two sides of healthcare as it exists. Essentially, medical biller will take verify insurances beforehand, before a patient arrives, decide what, find out what their plan costs to the patient, get that information, verify that their insurance is active, and also process the payments to and from after services are rendered, while basically dealing out the bills. Basically, a job that I wish was redundant, but because of our current healthcare system is not.
What do you find about it that's like not redundant? Because like I said, I know that we would have to fight with insurance companies to keep on funding people to like stay for like additional days if we felt that it was like necessary for a treatment plan. Sometimes we just like, pay for them to do it out of like the company's money if we could get permission, because the insurance is being difficult. Is it that sort of thing, or is it that they won't like pick certain procedures out of
I
curiosity?
want it to become redundant. I don't want there to be a need for like a giant
Oh, I understand.
billing apparatus for like a small practice. Like it should be basically negotiating with the government, a single payer, in order to basically process and maintain what money is coming in and out of the practice. But we don't have that, that's where I want it to be redundant. I want it to be just basically you're more of a bookkeeper, and less someone having to constantly be like, hey, we didn't get this authorization in time. Your insurance company's being kind of a dick. So we're going to have to change your appointment, and hopefully they'll get back to us this time and improve your care. Otherwise you're going to get hit with a giant fucking bill, shit like that.
Yeah, and this is yeah. I don't know. It's like I was just recently talking to my dad, found out that he had actually been paying $600 a month for his insulin again, despite having the insurance, because they were making him like switch over to a different kind that he didn't have a good experience with in the past. So yeah, just insurance in this country, the fact that we pay out of pocket for it and get screwed by it, like when it's time for them to actually do their job,
Yeah.
baffles me. And I'm sure that you see that on a regular basis, which sucks. But yeah,
Yeah. That's pretty much what I mean by let's make my job redundant. Let's make it so my job is almost unnecessary, because A, I don't like my job, and B, I hate what my job represents. and see. I'm a constant patient myself. You know, I have a number of debilitating conditions, and I know what it's like to see those hospital bills just pile up as I currently have, and it's fucking ridiculous what it is in this country. Um, I just wanted to set that kind of baseline to um, to kind of like build up kind of an understanding that we're generally on the same side, and what knowledge I will have, and to let you know that anything that I talk a little bit past you, just stop me. I will explain it the best of my
All right,
ability.
yeah. No, I appreciate that a lot.
Okay, so you want to give me your take?
Yeah, so I guess it's a developing take. I'm like not hardcore one way or the other. I don't like resent unvaccinated people. I understand I'm morally lucky because of the fact that, like, I didn't have like causes outside of my control making it to where I like listen to people like James Lindsay and Christopher Rufo and like all these other people on Twitter, Joe Rogan even saying like maybe don't get the vaccination, right? So I don't think that they're like morally reprehensible. I don't want them to be harmed. That being said, there's two things that kind of bug me in a triage situation where hospitals are running out of beds, where we might end up giving those beds um, to individuals who are unvaccinated and take them away from individuals who are vaccinated if we don't allow hospitals to include it as a factor, right? And the first reason that I would say is probably a reason that's actually more fair to make a prescriptive argument off of, right? Would be that if you have the vaccination and you're like having to go into the hospital, like you're more likely to have an outcome that results in you getting to like, continue to be alive than somebody who doesn't have the vaccination, as far as I can tell.
Mm-hmm.
And also like going into different levels of treatment for COVID, like on the vent, I think they've shown that people who are vaccinated are going to be more likely to be successful and get back off that ventilator again. Um, so to me, like if you have two patients that are basically indiscernible, right? And you're doing like triage and you don't have time to like get down to like the genetic level. Would it be justifiable at that point to just take the one who's vaccinated because they're more likely to live? And the goal of triage is to make decisions that save the maximum amount of lives, right? So that would be the one that I'd make the prescription off of. That maybe we should allow hospitals like the one in North Texas was wanting to do there for a little bit, to just say they're going to possibly make decisions based off of vaccination status when it comes to triage. The other one is a little bit more of a feels argument. It just kind of like, I don't like the idea of people who didn't do like their part, didn't wear masks, didn't even try to stay home for like the initial lockdowns, and then didn't get vaccinated, taking away beds from people who didn't. And that's more of a entitlement argument. And I wouldn't probably yeah, I wouldn't use that feeling argument as justification because I know that it's not a moral justification. It's just kind of in my gut. I am inclined to feel that way. And I didn't want to like, misrepresent myself, pretend like I'm some like holy saint that's like completely logical and doesn't think that way as well. So maybe that's also misinforming the way I think about the more logical reason that I mentioned first as well.
Mm-hmm. Mm-hmm. Okay. Um, the first thing I'd like to address, we might have to circle back to some of the things because I couldn't get my notes down in time. I have ADHD, so it gets a little difficult. So bear with me. How you described triage? Can you say what you believe triage is again? Hello? Um, you're muted.
Oh, I'm sorry. Did that can you hear me now? Fuck me.
Yeah.
Let me leave this open. Yeah, so I would say that it is people that triage is. if a hospital is low on beds or like has a very limited number, it's deciding who gets admitted based on like likelihood for them to have a positive outcome from treatment. And it's also, if a hospital becomes full, deciding who needs to be sent home or lowered to a or put on a lower level of treatment, I guess, if they are less likely to have a positive outcome from that treatment as well.
Yeah, that's not what triage is. So
Okay.
I just want to start with that fundamental understanding. Hospitals, providers always triage, no matter whether there is limited resources or not. Triage is more so about making decisions of who needs to be seen first. The kind of intricacies of that, like who is in the most dire need to be taken back first, because hospital emergency rooms fill up in a lot of places all over the country, regardless of COVID. I live in one of those areas. We have a poverty and gun problem. So, my local hospital, when, like, let me put it this way: when I went there for my gallbladder, I had some gallstones that would require normally for my gallbladder to be taken out. I drove to the closest hospital to me. And I was there for 12 hours, spent most of my day either in the waiting room or on a cot in the middle of a hallway because of how busy they were. And this was 4 or 5 years ago, something like that. And they wound up just telling me to go home and giving me a prescription without realizing that my gallbladder was actually infected, which affected me later. But in comparison to the other emergency patients that were there, the mass amount of them, I was not a priority in that case. I was not deemed somebody who needed the type of emergency care that more of the people who were at the hospital or who were there before me needed. So it's a way to kind of keep the line moving, I guess you could say. Unless it can be used in instances regarding scarcity, and it is to prevent some scarcity, but it's always used. You see what I'm saying?
It's not just something basically that you do, yeah, just in emergency situations where there's a limit of resources. Like this is something that you do all the time to make sure that, yeah, you're only giving patients like what they need and
In the
probably
hospital setting.
also not, yeah, overspending on their insurance or, yeah, I'm sure there's a lot of reasons that you do it that way. But yeah, that makes sense.
Yeah, and honestly, insurance status. This is where we get into like the article I sent you. Insurance status and ability to pay is not taken into account.
Yeah, that's definitely the way that it should be ethically.
Yeah,
Very glad to hear that. Yeah.
yeah. They have a legal obligation as of per the Emergency Medical Treatment and Active Labor Act to take in emergency patients. It was something passed in 1986 because what they found was a number of private hospitals were basically dumping off patients that were more expensive or less likely to pay to public systems, and it was crowding those systems a lot more. So they have a legal obligation to take in emergency patients and people who are actively in labor. So that's
Okay.
the first thing I wanted to point out as like the legal argument. But they triage those under any circumstance, whether there is a availability of beds or not.
All right. So yeah, so they're always conducting triage, but still triage is like the mechanism that's used. Like for example, when New York did send home its elderly, or when the I know this is outside the U.S., but when the hospitals in Italy stopped taking people over a certain age, like that was still a function of like triage, the practice of it, if I'm understanding correctly, right?
Yeah, more or less. Um, no, yeah, you're correct on that. That is part of it.
So I would say that like yeah, and the situations of scarcity triage is more like is it supposed to be used in such a way that you're trying to save as many lives as possible by treating the people who are most likely to like have a positive outcome, or is that
It
what you're always doing with it? Is that not the case when you're in a situation where there's like limited resources?
well,
Yeah.
it's kind of a broad way to saying things. This is why I focus solely on it. Is, what you basically described was healthcare. Period. The idea of healthcare is to save as many people as possible, and also with limited resources, what's available to people, even including what's not just tangibly available, but what knowledge we have at that time to treat certain illnesses. Um, so where that kind of stuck in my craw is that it's not just about rationing care. And to describe it in the way that you did is so incredibly broad that it kind of misses the point of specifically what hospice or what triage does. You get what I'm saying?
Yeah, I guess I'm basically wondering if you could like explain it in layman's terms, in a less broad way. What is the function of like what triage does, and is the function of triage different when like beds are limited or resources are limited to the extent where like you actually can't meet the load of like what you're supposed to see? Like is that something that you see outside of the pandemic sometimes at hospitals?
You definitely see it outside of the pandemic in hospitals. Um, the best I can try and create an example. Um, so let's say three people have been shot. One person was shot in the foot. One person was shot in the arm, and another person was shot in the neck. Who do you treat first?
Um,
That's what triage is.
got you.
That process of trying to, I'm not asking you to figure out the conclusion to that, because even I'm not qualified for that. You could say because that's where it gets like a little intricate, because the person shot in the neck could be someone who is not going to respond to any sort of treatment and die pretty quickly. Need to be
Lord
resuscitated.
Freiters gifted a tier 1 sub to
Hang on.
Ashling_feminist
No worries.
critique. They have given 127 gift subs in the channel.
Lord, thank you for gifting a sub to Ashleen. God, did I say that right? I always go back and forth. Ashleen, it's good to see you. But yeah, it's that sort of decision process of how to keep the line moving in that way to get help to the people who need it the most first and would be most responsive to care. I think is the best way I can describe it in like lay terms.
Yeah, whatever's going to be most likely to. Yeah, you said whoever's going to prioritize people who are going to be the most responsive to care.
Mm-hmm.
Okay, so
very very basic bare essentials description of it.
yeah. So obviously, I guess with COVID, there's probably a lot more factors than simply vaccination status that you obviously have to take into account, right?
Very much.
But yeah, you said outside of that, you still run into these situations in hospitals where you're having to like prioritize like one over the other. What would an example of that be? Like just pre-COVID times.
Well, like the one I gave you, the three gunshot victims. You know what I mean?
Yeah, because you have a limited amount of emergency room beds and like surgeons. Got it. Makes sense. Okay.
Mm-hmm. Yeah, and also you have a line. You ever have you ever been to an emergency room?
Yes, but it's fuzzy the two times that I have, to be honest with you.
Was it like a severe emergency sort of thing where you're like pretty unconscious sort of thing, or was it like a long time ago?
One of them I was in like pretty severe emergency, like had lost some blood, like it was bad, and then the other time I was under the influence of a lot of substances, so that one's just gone.
Mm-hmm. They triaged you. They probably triaged you lower for the substance abuse than they did for depending on your condition. They probably triaged you lower based on your condition for the drug substance abuse than they did for when you lost a lot of blood.
And that's just like determining like what ward you get put in, how often you're going to need to be checked on. Like, is that what you're describing as triage there? Or?
It's basically a bunch of people show up in a room. They're not orderly or anything. It's putting them in the line based on need and ability to treat them properly. You know, it's just a way to kind of keep the line moving in a way that helps the most amount of people.
Yeah, I just feel like sometimes the need and the ability might be like opposed to each other, in which case, like, would you say that they're more inclined to move and like decide in the direction of ability or decide in the direction of need?
It really kind of varies, honestly. And you know, this might be getting slightly out of what I know, because I have not worked in an emergency room, but I have been trained on triage. I do know what it is. The versions that I've had to use when I was a CNA had to do with, you know, okay, whose needs do I cater to first in order to properly give out care, like somebody who's you know, in heavy distress versus someone who's just like, I need to be put on a bedpan. You know what I mean? That's also a form of triage.
Okay, I see.
It's like an organizational sort of thing in a way, but it is based on like who's in the most immediate need and who can get that need and be helped the most. And the second part is like the smaller part.
Yeah, which is the ability to do so. Okay. So when it's a matter of limited resources, does the ability to do so become like more important, or is it
definitely
still need first?
It definitely becomes more important, but you still do it based on need to the best of what you have available.
Okay, so I could understand then why it would be either highly unlikely or just kind of opposed to the way that I guess they teach medical professionals to like ethically approach it, to consider vaccination as a part of like whether or not to turn people away.
Exactly.
Especially if they're prioritizing need over ability to do so.
Yeah. Because the vast majority of the people who are showing up to the emergency rooms are the unvaccinated. They're the ones that need to be admitted. They're the ones more likely to need a ventilator. If we just start turning them away because they're unvaccinated, then we just turned away the vast majority of people who needed care. We're basically just telling them to fuck off and die. And you can understand why you got like the response you did from Freems, or even my initial response.
Yeah, so I would say that's the Twitter character limit doing me in there, because that's definitely,
I got you. That's why I wanted to talk to you.
Yeah, that definitely wouldn't be my prescription, right? My prescription would be if you were in a situation where like you are basically having to either send people home or turn people away just due to the fact that you are at capacity. And I do think that I rotted my brain out last night talking to conservatives about vaccine mandates, but Destiny and like Dylan Burns were there, and I don't remember which one of them did, but one of them brought up the New York hospitals are 110% capacity right now. So if like that trend continues and they continue to spike, at that point, are you justified in being like, yeah, we can, for example, see that like people who are vaccinated are going to have better outcomes on the ventilator than people who aren't? So after we send home like the people over whatever age they decide to cut it off at, since that seems to be where these decisions start to be made, as dark as that is, like at what point, if any, do you think it could possibly be justified to start accounting for vaccination status as well, or would you just say like the whole way down that that's not something that would ever come into play?
Well, this is where I brought up a couple of articles. The one of the ones that I sent you, the AMA uh, statement on denying care based on vaccine status. What they ultimately state is like in this first bullet point, it says that like here's how it's prefaced. Let's find that. So, in the context of highly transmissible disease that poses significant risk of severe illness, for which a safe, effective vaccine is available, the decision to accept or decline patient must balance the urgency of the individual patient's need, the risk the patient may pose to other patients in the physician's practice, and the need for a physician and staff to be available to provide care in the future. Among the questions to be considered, what are the unvaccinated patient's medical needs? How urgent are those needs? In emergency situations, physicians may not ethically refuse to provide care regardless of the patient's vaccination status, but it may be justifiable to decline to provide routine care, such as an annual physical examination for an otherwise healthy patient. This is why healthcare providers that are non-emergency, like outpatient places, can deny you based on if you've had a previous positive test or if you refuse to wear a mask, things like that. And
Okay.
yeah, and that is most places, from what I've read and what I know, do not deny based specifically on vaccination, but will deny you based on, like, if you're unvaccinated, you need to have a PCR test very recent. Even as things stand now, with my personal care physician, who I've been seeing for close to 20 years, even now, I have to have a pretty recent PCR test, not the rapid test, on record negative before I can go into their office.
Wow. Yeah, I haven't been to the doctor in a bit, but that makes sense and sounds like it'd probably be a good idea. Is that like standard everywhere now, or is that just in a select few like cities that are starting to do that?
This is the statement of the AMA, and the weird thing about the US is we do have a national standard for what healthcare is supposed to do, especially regarding conditions for triage, but they're not consistent state to state. That's where you see things like in the article that you sent me, the examples of Alaska, New Mexico, Montana, Idaho. And even then, what they ultimately state is they're still not denying care based on vaccination status, but the ability of, like, a ventilator, in the case of a ventilator shortage, to be able to improve the person's condition rather than maintain it, is essentially what I got from reading your article. You know what I'm saying? So I'll try to explain it a little bit better. So even if a patient is not likely to get better on a ventilator, but it's basically keeping them alive, and they have somebody who would benefit more from being a ventilator, in the Alaska case specifically, because Alaska is the only state that has this the CSC plans set out. Alaska's case is if there is somebody who is more likely to be to improve their condition on a ventilator versus someone who would maintain but otherwise die on a ventilator, they would remove the ventilator off the person who would just be maintained and likely die without it. But even then, I would love to see it because I don't see. Maybe it's in the hot links. I don't see it. I want to find out how they actually arrive there because normally there's a number of conditions that you have to be met before. Oh, and of course they don't fucking have it. That have to be met before you can just take somebody off a ventilator. For one thing, they need to have a do not resuscitate order in place, which is if they're unconscious and on a ventilator, would have to be signed by next of kin or whoever has the durable power of attorney over them, based on living will, or if there's a provided attorney, which sometimes happens for people who don't have next of kin. It's just a whole process that I would love to see more information on how they get to from point A to point B, because it's not like the doctors just make the decision, okay, well, we just take this ventilator off of them. But it might even be because they do say that they expand the liability protections for doctors too. So who knows? I'd like to see more. I definitely don't like that, but I also understand that a lot more than like what you seem to be proposing on Twitter.
Yeah. I just need to stop proposing things on Twitter, honestly, is what I'm learning. That being said, yeah,
I don't think people need to go that far. I think there's always going to be people who are going to throw certain ideas out. It's just about not being entirely married to it and being willing to look up the information out. Like, I'm probably the most careful Twitch politics streamer about my takes out there, because I don't want to have to walk back my shit, because nobody usually does it. Most people are willing to push back and just, be married to a take that they have because they get pushback. I'd much rather not have to deal with that and not have to eat shit on a thing than just have the take out there and watch it blow up. You know what I mean?
Yeah, absolutely. It's ironic because I literally was I've spoken to a friend a couple of times about how it's not just about like being correct or like them misinterpreting you. Like at a certain point, if everybody's like taking you the wrong way, then you have to be introspective about the fact that there's multiple people, if not like a ton in some cases, taking you the wrong way, and that's probably on you. So
and I'm not saying that you were seeking attention. I do want to say that. I mean, for one thing, you were replying, you were in Lance's threads, so
yeah, I only quote tweeted you and I was just like, okay, let's have a chat.
Yeah.
But yeah, I don't I'm not the reply guy to seek attention. I go on Twitch panels and yell at people who make ridiculous arguments for attention. That's my kick there. But yeah, so what do you think of that the argument? Did you see basically the article I sent you that the like North Texas boards were making in favor of like being able to enqueue that?
I saw that what they had said was they were kind of trading around the idea of it, and it got leaked and people got pissed off, which is kind of funny to me. I was just telling my stream before that it's really funny that these people would get so pissed off about them possibly being denied care for COVID based on vaccination status, when they also simultaneously don't think that COVID can kill you, that it's not as bad as people make it out to be. But I did see that. Hang on a second. Go away. Let me just review it really quick just to make sure I have a full understanding. Appeared to be planning to add COVID-19 vaccination status to the triage factors for hospitals in North Texas region based on an internal memo. A state of vaccination status may be considered in a physician's assessment of an individual's likelihood of survival. I would like to see more of the details on that, because there's still some missing information there. Like, because it's not as simple as, oh, you're unvaccinated and you're an emergency patient. No, get out. You know what I mean? Jesus.
Like the only argument that you could make in favor of it would basically be that one out of I think it's like 15 to 1 is what some of the stats are saying is like the people that are now dying of COVID as far as like vaccinated versus unvaccinated. But the issue there is that like, are you going to still see that discrepancy once they get to the point where they need like emergency treatment? Because supposedly the vaccine is preventing people from needing to be hospitalized, so therefore.
Yeah, and not one for one. Not one for one either. There's nothing one for one in healthcare. The human body is fucking crazy. I have to stress this a lot because you get people who just misinterpret a lot of ideas surrounding healthcare. Like the idea that the vaccine doesn't completely prevent you from getting COVID, that you can have breakout infections. Of course, that is going to happen. It prevents it. It's about mitigation. There's no 100% cure for roughly anything in healthcare, because there's always going to be conditions that come up with your body specifically. You can be vaccinated, get COVID, and be in a worse condition than someone who is not vaccinated and gets COVID. But it's less likely for you to get to that point, and it's about reduction of harm rather than full-on prevention, which is impossible. You know what I mean?
Yeah, that makes sense. And then I guess at that point, it would just be so rare that they'd have to be making like that kind of a decision that, and then also like the more that I think about it, like we probably don't even like have the ability to do the studies and get the sample sizes to like demonstrate what the effects of the vaccine would be on like the outcome of emergency treatments, because we can barely study long COVID at this point just because of how new a lot of this is.
Yeah, not to mention the fact that like we're in an emergency situation where a lot of doctors are scrambling. There's a lot of healthcare workers who are getting overwhelmed and quitting. Like we're in a crisis scenario, and if we're asking doctors to also keep track of extra information for a study that could help us later on down the road, like it's just going to tax our already overtaxed healthcare system. It would be bad.
Yeah, and then another thing I wanted to ask while I was here, at least, do you foresee us getting back to a place like with Omicron at the vaccination rates that we are now, anywhere in the country where hospitals like become like taxed as far as like their ability to provide beds, or do you think that we're at least going to be able to keep it more under control than we were, like, say, in the summer or last winter? You're obviously not an epidemiologist. I'm just wondering if maybe you did have some better insight into that than the layman would.
From the stuff that I've studied and like what I've looked at from epidemiologists and everything, that sort of thing.
Yeah, from what you've read, since like obviously I think you keep more up to date with this stuff than I would.
So I'm trying to think of how nice to put it, because my view is pretty cynical. We'll say it's not positive. COVID flare-ups have always been on a 2-month cycle. They go down, they go up, and the reporting is always staggered. We're always going to find out way after the fact the things like hospitalization rates for specifically COVID, because we have to wait back on testing. We have to wait back on a number of things that can slow down the process in the reporting. So you're talking about 2 weeks before we find out the information for a 2-month cycle. And we're in the holidays. We will probably find out exactly what kind of effect Omicron and the holidays had on the US in about late January, early February. And that is when you'll see, from what I've read, a pretty massive spike. But hopefully what's being suggested is true and Omicron is milder. But then we have to also worry about another variant popping up. Because, like, I've also heard that we honestly don't know about Omicron being less mild. There's also been reporting that it could be just as severe as Delta.
Yeah, there's just I've looked into it enough to know that there's like conflicting reports and that people are just being way too eager to assume that it's fine and go back to
people are
life
panicking.
as usual.
Yeah, people are panicking, and the capitalism machine needs to get back to normal, get people back to work. Come on, baby, we're lowering how many days you need to stay home. That's 5 days now. That should be enough time, right? Yeah, get back to work. Yeah.
And as far as I can tell, it's like a lot of these jobs could just continue to be done from home, and
they could.
But bosses are still wanting people to come in on some kind of, like, I don't understand what it is. It has to be some power trip thing. Like, I've seen indications that production has gone up. It's a cost less money. You don't have to rent out an office building. Like, it makes no sense to me.
Well, that's talking about like office work and not like production work, which is still
of course.
a large. It's still a large enough percentage of our industry in the U.S. to matter. As you can see from the supply chain issues that we've had, it causes a lot of inflation. Having such scarcity based on the ability to have workers show up and pay for this stuff. But I mean, there's ways around. There's not a way around the issues regarding the supply chain, but there is ways around us having to worry about it long term versus just like slapping the pause button and paying people to stay home, with the exception of essential workers and providing them with proper protection. It's there's not really a I don't want to say cure. The word is escaping me. But there's not really
way to eliminate the virus at this point, basically, is what you're trying to say, I think.
Especially under capitalism.
Yeah, no, you can't tell people to stay home and then not give them the resources to do so. It turns out it's
and if you show that you can provide them with healthcare and a universal basic income or something like that, or even a jobs guarantee from your home, that's socialism, I guess. And now the government's taking care of everybody, and that's apparently bad somehow. But I don't have a very positive outlook, but I'm not going to say like everybody in America is going to die from COVID. I do think that there's going to be an attempt to normalize it. That seems to be the case as things stand now, that they're trying to normalize it in society and make it sort of like the flu. Problem being things like you said, like long COVID. That should be just as much a concern of everyone as dying from it.
That's what I said last night to because I was talking to conservatives and people on the left about vaccine mandates, and I was just like, I think the biggest optical mistake that we made talking about this is people who are concerned about it and aren't vaccine skeptical is they just keep on railing on about like the mortality rate, the mortality rate, the mortality rate, and it's like, yes, it's awful how many people have died because like it's insane that we're probably going to see over 1 million. But if you just want to talk about it in a percentage format, like you can look at the amount of people who are displaying symptoms of long COVID, like 180 days out, and like the lower estimations, depending on which studies you want to look at, are like 7%, and like on the higher ends, like with possibly lower sample sizes and maybe not as accurate, like 13%, right? And like long COVID symptoms means anything from like shortness of breath to like headaches to like brain fog, et cetera, et cetera. So not everybody's like getting
even
the
far
worst of
beyond
it
that.
necessarily.
Even far beyond that, because the thing I really recommend looking up the interview that Matt Bender did with a doctor who was like a part of a group that was studying the possibility of ivermectin helping, and later divorced himself from that group because they were just pushing it without actually letting the studies finish. Because he gets really into the weeds in a way that most people can understand. What COVID does to the body is it can create clots. This is why symptoms of long COVID have included such varying things. The basics, the consistent ones are the brain fog, are the breathing issues. It is those things. But we've seen everything from cardiac issues to nerve pain to people developing diabetes, people developing neurological disorders. Like, it's all over the place because these clots can pop up anywhere. That's why a main treatment for COVID when you're in the hospital is to put you on blood thinners to decrease the likelihood of clots. It can really happen anywhere. And that's, God, people downplay how unbelievably insane this virus is so much without realizing that they don't know a goddamn thing about it. And if they bothered to look it up, they would be scared, and they should be. Because
I try to go.
The other thing I was going to mention is Omicron is tearing ass through schools right now. And they're like, oh, kids, they're fine. Their immune systems are strong. They're not going to die from it. We're basically talking about raising a generation where a large number of them are going to grow up with these disabilities from this virus. And we're just saying, they're okay. We're talking about an entire workforce that's basically going to have brain fog and breathing issues for how long into their life? And that's the minimum. It's so stupid.
Yeah, and all I hear from the people who I don't even know where you stand on vaccine mandates. I'm getting more and more just to the point where I don't know how much use they'll even be if we tried them.
I'm
still
pro.
Really opposed to it.
I'm still pro vaccine mandate, but probably not in the way that a lot of people suggest, where it's like, gunpoint and blah blah blah. The authoritarian nature that a lot of conservatives believe. My essential view of what should be done as far as what would be considered a vaccine mandate is, vaccine cards at premises, and you wouldn't be allowed to enter those premises without providing proof that you're vaccinated and that your vaccine is up to date. Or you need to have like a negative test within the last couple of days or something like that in order to enter private businesses, public offices, things like that. And we could use trespassing laws to prosecute anyone who refuses to stick by those orders, in the same way that mask mandates were offered per work safety. You know what I mean? Under the same law that requires you to show up wearing a shirt and shoes, that example we've used a lot. You can enforce mask mandates. You can enforce vaccine mandates. we could do it that way. But just not allowing them to kind of participate in society without these added these added inconveniences to their lives without the vaccine, to encourage them to get the vaccine, rather than just punishing them outright for not having it. You know what I mean?
Yeah, so that was that's mainly what I've argued for at this point, because it's like I was told you I was talking to a group of mostly conservatives last night, and one of them was losing their mind over New York passing this bill that said, like, you have to be vaccinated to go to the bar and to go to a restaurant. It's like, this isn't a mandate. This is just like you can learn to drink and cook at home, I suppose. Like, I don't know.
Yeah.
Like, this is
You're gonna have people over your house. You can be that stupid if you want to. Just don't subject the general public to it, who have no idea who you are or whether or not you're vaccinated or not. Like, that's the biggest thing that has drove me nuts about these arguments. And we'll talk about the empathy thing in a minute, so don't let me forget. But it's that they make it as a freedom argument, but whose freedoms are you stamping on to subject them to you having COVID and you giving it to them? I thought freedom ended at the tip of my nose, or your freedom ended at the tip of my nose. All of a sudden you're telling me, no, I can give you a virus because fuck you. I get to do whatever I want. I did everything right though, but you can go ahead and give the virus to me. That's fucked up. I have freedom to stay healthy. I have freedom to do everything I can to stay healthy, and prevent getting this virus. And you're putting me more in danger. You might as well be walking around swinging your fists at people, because you're causing just as much damage. And you're being just as belligerent and stupid.
Yeah, I have nothing to add to that. I've made similar arguments, and I'm like, yeah, having flashbacks about the like circles that they run in to get back on their talking points when you do it.
Yeah.
I just, it has to be more luck, because it definitely isn't. Just a thing that you can explain it to everybody well enough, and they're just going to get it. Like, there seems to be an emotional attachment to thinking that these vaccines are more dangerous than the virus itself somehow, right? Heard arguments about like the side effects that they have been able to demonstrate, like acute myocarditis, which, as I understand it, is like very rare, but also acute, meaning not permanent in most cases, I would say. If I am understanding what that means correctly. I looked it up and it seemed to be correct. But,
it's acute. It's like I don't want to say a singular instance, but it's just like an instance of that happening. And even then, I think it's very mild. Like you'll get like chest pain, might land you in the hospital. They'll do like a EKG on you, and they'll be like, you got the myocardia is inflamed a little bit. We're going to put you on this to lower that, blah blah blah.
And can't long COVID actually cause more permanent like myocarditis flare-ups, basically we're seeing now? Or
I haven't seen mass reports of it. Like, it's incredibly rare, okay. But whenever I've looked into the claims of myocarditis, it's it's not good. Don't get me wrong. Myocarditis isn't something you want to fuck around with.
Yeah, but it's very rare from the vaccine. I guess. Yes, I was asking, is the long-term stuff, like, is there long-term heart complications that I think I've heard of that you get from like the virus itself, though, more so than the vaccine, or is that incorrect?
No, that's true. That's true. Like I said, the way the virus works, creating clots, it can affect almost every single system. Think for anything that is like that has that isn't a enclosed system within the body that has to rely on blood flow. That can cause different issues and conditions all over the body. Clots are not.
Blood is.
Yeah, clotting is not something to fuck around with at all. Clotting can cause strokes, and that's another thing. Gritty, you know what to do. I got somebody who's just straight up saying you're an idiot and you should stop lying to your viewers. Good argument, bud. Anyways, enjoy your ban. But yeah, the fact that clotting can affect any system of the body that has to rely on blood flow. And that's why that's usually, in most conditions, the first thing they look for. There are people who have gotten strokes from long COVID. You know, that's rare, of course, too. I don't want to say that, you know, this is a common thing, but the fact that there's that possibility and it's based along this common thread of long COVID and clotting should make people realize that they need to take it seriously.
Yeah, I mean, it adds up. Like, because you have the really dangerous stuff that happens as a result of the long COVID, and then you have just the minor inconvenient stuff that still makes it harder for somebody to work. And like you said, like, this is possibly going to really hurt our productivity. I also, like, yeah, most of the people I know who have these symptoms and don't know when they're going away are pretty depressed about it, and I don't think that that's great either. I got lucky. My lungs basically, like, eventually started just feeling like they were fine and recovered. But, like, yeah, I know other people who are still just, like, not tasting, for example, or just like stuff like that, or not tasting the same.
Mm-hmm.
Yeah, it's
like I work out of a physical therapy center, and our physical therapy director, he caught it. What was it? February, I believe. Like just before he was able to get his second vaccine. And he still has a heavy cough that we can hear because his office is like right across from mine. Like, it's, I have, my family's been lucky and we haven't gotten it. The only people who have gotten it was my parents had a breakout infection, which got really fucking scary because my dad has COPD, and they live in Florida, but they were in Michigan at the time, and it got scary even then because of the COPD. But my dad says he's fine. He doesn't have long COVID. I don't know. I don't understand anyone who doesn't take this seriously. And just to address someone in my chat, I'm not going to address someone like that because they're coming in bad faith. They're not going to be convinced. Otherwise, they likely have retreated to their echo chamber anyways. So rather than wasting the time and energy on someone like that, I'd rather just let them go the way of the dodo on something like Twitch. We have not been able to find the right arguments to convince these people that they're wrong, and there's a likelihood that we may never. So there's a lot of energy being spent trying to convince people to believe us when they think that everything from us and the information that we get is all completely false and we can't believe it anyways. And if you talk to them long enough, they'll reduce everything down to, well, what is truth anyways? I'd rather not waste my time and energy on that and have like an actual productive conversation.
Yeah, it's my experience has been that even if you can have what appears on its face to be a productive conversation with a lot of these people, they will, like you said, retreat to their echo chambers, ask their friends about basically what you have convinced them now of, and then they come back the next day just as conspiratorial about everything, and then you have a whole new set of problems to solve, and you can do it for weeks and weeks and weeks, and it's not actually ever going to bring them over. Mm-hmm. Due to the fact that the echo chambers are fueled by like influencers on social media now, which are materially incentivized to like preach this vaccine skepticism and preach the COVID skepticism.
I mean,
Yeah, it's just a lot of moving pieces that we don't really have a solution for. It sucks.
yeah, we're talking about people who are working back from a conclusion. How
Yeah.
can you convince, like, you have to get them to stop doing that, and that is really fucking difficult to do because they're convinced that that's how they need to look at things. If you're working back from the conclusion of COVID isn't that deadly, the vaccines are worse, ivermectin good, hydroxy good, then you're just going to search for information that confirms that bias you have, rather than starting from a position of, I don't know anything about this. I'm going to try and learn as much as I can about this based on the information that I can find that is available. Like, they're starting from a position of people I like said a thing, so that's my conclusion, and I'm working back from there. Getting them to stop that, man, when we figure that out, somebody hit us up, okay? Somebody tell healthcare workers.
Well, yeah, I mean, it's like I usually say to people with this stuff, it's mostly social media that reinforces like whatever thing that they're looking at, right?
Mm-hmm.
Because the algorithm is designed to keep your eyeballs on the screen, and it's not really designed to solve for like the conspiratorialness or the harm that's caused by what's keeping your eyeballs on the screen. It's just designed to seek profit. So I guess if we could find a way to tamper the law, like profit motive, down a little bit for social media companies, maybe we stand a chance with stuff like this. But it's not just going to be COVID; it's going to be all kinds of misinformation that we've already seen since basically, yeah, as long as I've been an adult, as far as I can tell. And it just keeps on getting more and more polarized and harder to have conversations with these people. And some of them are just becoming willing to lie because they'd rather do that than concede. Like I had somebody tell me yesterday that their two cousins had a stroke after getting the vaccine. I'm like, okay, just no. Statistically, like you're not the that would be on the news. I don't know. Like,
Yeah, if if there's a possibility that something related to that, they're probably doing the whole VAERS thing where they got the vaccine and then they had a stroke. Ipso facto, it's because of the vaccine. Except for there's so many different things that can cause strokes other than the vaccine, and even if it could be related directly from the vaccine, it would be insanely rare. And that's when you need to look into, you would obviously take it seriously because then you need to look into whether or not the vaccine is causing clotting disorders and which vaccine it specifically was. Did they even say which vaccine they got?
nope, just that there were two of them, and yeah, that's the important part. There were two of them. That way, it's not just a coincidence, right? That it happened. They eventually explained it happened like 2 days after the vaccine, right? So it's just like, yeah, it's just like you're never going to convince these people. I don't think you're ever going to convince their audiences. I don't think they don't do anything except for like talk about very believable sounding anecdotes if you take them as trustworthy in front of your audience. I don't even know if it's worth it. I agree with you. Like we're past the point where unless we find some kind of smoking gun argument, they don't seem to care about long COVID. They don't seem to care about the mortality rate. They don't seem to care about their kids and the fact that like Omicron is going to be running through the schools. They just trust whatever influencer they're listening to.
It's a culture war. They trust the culture war.
So yeah, I guess on our end that just means we vax up and try and do our best that we can like be able to protect ourselves while still earning enough to pay our rent and put food on the table. I can't believe it's been 2 years. It's fucking crazy.
Yeah. I don't know why I thought I had high hopes for Biden having an actual plan for COVID, but I did. That was one of the few things I was like, well, at least we'll have an actual plan for COVID, but it doesn't appear that he has any other strategy other than let's just kind of normalize it and push people back to work sooner. Cogs in the machine, if they get ground up in the gears, so be it, sort of situation. And
sorry, my audio cut out. Who were you saying that's their strategy?
The Biden administration.
Yeah, they were supposed to do a better job, and fuck it. I haven't really come out with this yet, but I'll say it. Like I don't see a difference. I don't see a meaningful one. Not with the COVID response. It seems to be acting like everything is fine. We're at least getting better, right? And it's just not.
The-
It's just not. Yeah, as far as I can tell, maybe I'm wrong.
What's really fucked up is if you look at like cost benefit, um, who did you get more protection from, Biden or Trump? And that's the scary thing that we have to think about going into 2022 or moving on beyond this. Like, people are like,
Yeah,
well, I got what, $3,000, $4,000 from Trump, and I was able to stay home and get extended unemployment benefits, and Biden let them go away, and Biden got my cousin evicted, and all he gave us was $1,400, and then $300 a month per child if you're a parent, and then that went away. Like, there was no contingencies on either side, but the more reactive one, because the party that actually wants to govern and actually can get things passed did that. The Republicans look better right now, even though I know they're not. And that is the scariest thing that we have to deal with going forward. So the normalization is likely to happen. This is likely to be a consistent part of our life unless something big changes on the left. The country has to, the citizenry have to move left onto the people of Washington in order to see any sort of meaningful change to actually combat this virus in a real way. Otherwise, the right has no answer, but they're going to win.
yeah. They have no answer, but they, at the very least, understand how to give people just enough to feel like they're not getting completely screwed. Like you said, the extended unemployment benefits were a boon for a lot of people. They're honestly a boon for the economy. Like, you give a bunch of poor people money, it turns out they spend it really quickly, and it creates a lot of economic activity. We lost about $3 million out of our GDP here in Texas the month they went away.
Yeah. I'm scared to death of what's going to happen from losing the child tax credit. My family relied on it.
Yeah, that's I cannot believe that they had one landmark bill, just one, that they had to get passed. And yeah, we're arguing about inflation. We're arguing about like where will the money come from when they all know, they've done the math too, right? That you can just like repeal the Trump tax cuts.
Well, even
And like
regardless
it'll
of that,
pay for itself.
where's the inflation coming from? Well, let's see here. There's supply chain issues. There's issues with finding shit, the transport, the boxes. I'm forgetting the name for them. Like, to deliver stuff overseas, we have supply chain issues that are driving up prices. Shipping, cargo containers. Thank you. That's driving up costs. What was driving up costs for fuel? It was fucking Saudi Arabia being pissy about us not doing an arms sale. And guess what? As soon as we did the arms sale, our gas prices started to go down. Also, the fact that more people are driving now, so of course gas prices are going up. The idea that inflation is happening because poor people had more money is a fucking joke. Not even remotely true.
Yeah, that's not how money, like, yeah, I think that, yeah, we've been on economic panels before. Like, we both basically understand the velocity of money.
Yeah.
If you distribute it to the right part of the economy, it creates value every time it changes hands. Like, by the time it gets to the top, some would even argue it has a deflationary effect, right? The issue is like, yeah, that's not how we usually do it. We did it that way for a little bit. It actually was really good at creating, like I said, economic activity. And they had to take it away because they found out that if they did it for too long, like, people would realize that this is something that they could have just done, first of all, which is kind of a slap in the face for anybody who's like been struggling for years. and
finding
can
out that
continue doing.
Finding out that they could do it all this time is detrimental to the neoliberal project 100%. And just to kind of cycle this back to healthcare, the idea that God, I forgot the name of what the bill was that they passed. It's not the CARES Act. What was the one that that Biden signed? You know what I'm talking about. The COVID relief.
For COVID relief?
Mm-hmm.
Yeah, I'm blanking on it too, actually, now.
Yeah. But you know what I'm talking about. I don't need to remember the name. But
yeah, I know what was basically being proposed.
One of the things they did regarding healthcare, I swear they did it they did it in this way just to show that just to not give the idea that we could actually have something like Medicare for all or a single payer system, subsidizing Cobra, the most fucking expensive way to provide healthcare for people who are out of work. Pay overly expensive Cobra prices to private insurers to subsidize them so that they continue to give health insurance to people who are out of work, rather than just saying we're going to expand Medicare to cover these people temporarily, because God forbid they find out that Bernie was right the whole fucking time. I'm sorry, that's just my own rant. That just absolutely pissed me off about what they did.
Well, yeah, and then they started pointing to a poll that was actually... So this is that one poll that basically said, like, hey, look, actually, most Americans don't want single-payer healthcare. They just want Medicare for all when you say it that way. And then you go look at the poll, and it's like they were trying to figure out the best way to market single-payer healthcare. And it turned out that when you tell people, like, that they're going to lose their private insurance, and that's, like, the part of the messaging that you stress the most, yeah, the majority of them were against it. But when you explain to them that it's cheaper, then, you know, their private insurance probably is right now, and they're more for it, shockingly. And that's literally all that poll said. And I've heard that like cited by Debate Bros like all across this platform. It is mind numbing to me. Yeah.
Oh yeah, it drives me nuts. I've been looking for a while for somebody to debate on Medicare for all. I got really close to finding someone in CTV, and he had to be a dickhead about the whole thing, and I was just like, yeah, you know what, like I'm very picky about who I'm going to correspond with, but I was like, you know, he came to my chat, he offered some pushback, and I was like, you know what, there's a lot more that, you know, I'm sure you could push back in text form, or, you know, in non-text form. Let's set something up, let's get a moderator so that you know, we're not talking over each other, because I can be aggressive on that, he can be aggressive on that. And then it turned to a whole thing in the DMs where he just kept saying, no, just show up to my stream. No, just show up to my stream. This is when I stream. And I'm like, I'm not going to fucking do that, because I don't think that would be fair to either of us. And he's just started berating me, calling me a pussy. And I was like, you know what? Fine, block, bye. But I've been looking for somebody to debate Medicare for all on for a while that could be actually interesting and fit my criteria. But
yeah, the only way that I could possibly foresee like a lot of policy and economic arguments like going well and in good faith, just like with the way that I sort of see the spectacle go, and I participate, like, obviously, but I understand that it is what it is. But the only way that I could see it like happening in a good faith way that isn't going to be like blood sportsy, as it were, is if like sources were shared ahead of time, like with reasonable amount for like both parties to examine the other sources. And then like a moderator that was actually going to be unbiased and examine sources as well. That way there's not, because I feel like what a lot of this comes down to, especially with healthcare stuff, is like, well, I don't trust your source because X, and I don't trust yours because X. And it's like, well, did you read the abstract? Did you check the methodology? And like, honestly, a lot of these guys, like, they're not going to know how to read studies. It's not a skill that I'm sure that I've mastered. I usually have to have somebody smarter explain it to me. But still,
I honestly have been trying to work toward finding a way around just sitting around and quoting studies, because especially with Medicare for all, you can explain it in a way that anyone can get it, even from the conservative end, just by avoiding talking about that. Just like the way I like to talk about it, you said once you explain that it's cheaper, that's effective. What I usually do is I usually point out that there is no way that the amount of taxes that you would pay on something like Medicare for All, even with the expansion to dental and vision, that it would be even a tenth of what you pay per year for your healthcare currently, unless what you have is a plan that is basically just don't go to the emergency room, just don't get sick, otherwise you're going to get, you have an incredibly high deductible to meet and we're not going to pay for much, that sort of shit. Like explaining it to them using very common terms and like using real life examples that I know they deal with can be very, very helpful. But I've also found a difficulty in understanding poverty too, because they individualize poverty. And not having that fundamental understanding that poverty is a trap can make things difficult for explaining it too. Studies are always going to be rejected on the right for the reasons that you said, but they want to be talked to like a normal person. They want to be talked to like a dude on the street. There's ways to do that. There's going to be hurdles still, but finding those talking points is important rather than trying to shove studies down their throat and making it really academic. That's where I actually do disagree with you on that being like balanced. I think what it needs to be is somebody who's willing to, obviously moderate fairly and just a conversation so that people don't talk over each other. People don't get way too heated. And, just talk to a person like they're another person. Sort of like how I came on and explained triage to the best of my ability without using a bunch of technical terms. I used examples that you can understand. I used extreme examples specifically for that reason, to describe what it is. And more people understand what it is now. You can do this. I can show you. Sorry, I'm not making it about me, but you get what I'm saying.
Yeah, of course. No, I find some conservatives that are very good faith and like, you can basically explain and just like, not with studies, but just kind of like common sense, like, you spend X, but now you like only spend X, so it saves money overall. Ways to bring them over on like everything from like criminal justice, drug reform. Like I've seen that with some individuals, but then there's others who are just like with the vaccine stuff. And this seems to be a concerning amount, if not the majority now, that will be pulled over while you're talking to them, but then return to their echo chambers and talk to somebody who like is able to pump them full of like more retorts to like whatever you came up with, and it's just
working back from that conclusion.
Exactly.
You're wrong. Now let me tell you why. Like,
okay, please.
Like, wait, no. First, tell me why I'm wrong, and then get to dancing on my fucking grave. Like, what?
Yeah, it's I did it like 3 weeks in a row with one person, and it's just it just got to the point where like I realized what was happening, and I just called, like I was just like, what is happening here is I am like addressing all of your arguments to your satisfaction, and you're actually like good faith enough that you're taking it, but then you're going back to like basically the community that's loved bombed you, getting like arguments to counter mine. And then now we're here on week 3, and you've returned to like half of your original talking points that I'm now addressing. So I don't know.
They probably have a financial
that
incentive to
situation.
stay there too.
True.
Yep. All right.
Yeah.
And any other disagreements on the unvaccinated part? I don't mean to rush you. Just
No. I want to let you go and do whatever you got to do, or finish up your stream. But no, I think that we pretty much agree. I probably overestimated how much we can actually know for sure. That yeah, vaccination status is going to affect outcomes once like things have reached the level where you need emergency care. And therefore there's probably other factors that we should use that are a little bit more reliable until, if that ever is the case.
Cool. I'm pretty glad about that. That went a lot easier than I thought. I pulled up a number of different things to use. I'm glad we reached that conclusion. Hopefully, like I had a early on. I talked about this last night. I was on Freeves' panel. I had an early on interaction with somebody regarding my fear of doctors being able to waive the need for do not resuscitate orders on their own without any sort of a legal or next of kin stepping in, because I had read a story early on that. So I get pretty worried when I see something that is leaning towards that. And that's what I saw in this, and I'm glad this conversation went better than that one, because at the time what they were telling me was to not worry about it, and that, you know, it's better for society if we do that. And I'm just like, it's a bad precedent to set overall. Even if you're saying it's temporary, they can always go back to and say, well, you know, doesn't this kind of constitute that? And then once it's set in stone in legal authority, it becomes a norm. And that shit scares the hell out of me as someone who works in healthcare. Doctors just being able to make that decision. Like, just being able to make the decision on their own to remove somebody off the ventilator worries me. That's why I want to see the details on that.
Yeah, it definitely doesn't make me comfortable either, especially as somebody who's been called a spa as well in an emergency room before. I'm not sure if you're familiar with like that and if you've been around nurses long enough, but yeah, like
what is it?
So most people who like work in the medical profession aren't like this. They really care about like helping everybody, like yourself, right? They would never like try and dehumanize somebody, but some people get better, right? And SPAS stands for subhuman piece of shit, and is sometimes used to refer to, like I told you, second time I was in there, was like substance abuse, right? That they consider to be a drain on like medical resources. So like,
yeah. I've heard it referred to in different terms. You know, concerns about people drug seeking, even on the patient end. You know, my wife's been in the hospital a lot over the years, and her big concern has always been, you know, what if they think I'm drug seeking? What if they think I'm drug seeking? Like, you know, you're not, though. You know, you just have to trust that it's not going to be like that. But I haven't heard. I think that specific phrase might be a regional thing, because I've never heard that specifically. But I will say there is a tendency of, when people work in healthcare, especially the more extreme versions, there can be times where you get numb to a lot of things. I saw it when I worked in hospice. I saw it when I worked in nursing homes, especially. That's more so where I saw it. I call them human factories for that reason, because everything is like production, and it's not care. You're just trying to hit like a quota. You're working a task list rather than being like, okay, did I care for these people long enough in the way that they needed? You know. So that does happen, and that is tough to fight. And I can tell you that what's going on currently with COVID is not helping. It's going to make things worse. Likely the people that had that sort of that more empathetical view are being driven out, because their empathy is just stretched so thin, and what could be left is the people who are a lot more lizard brained about healthcare, and that scares me quite a bit. But I understand how that can be a thing, and people need to, if you work in healthcare, you need to try your best to make people remember that they're human beings. And 9 times out of 10, the way they're reacting is because they're fucking scared.
Yeah, I couldn't have said it better myself. If you could indulge me, just one more question I was going to ask. So Germany isn't making decisions, as far as I can tell, based off of like vaccination status, but they are taking steps right now to protect disabled people from being like basically, negatively affected by triage decisions. Um, do you think that that's something that like maybe American courts should try to do, or do you think that like once we get to the point where there's like comorbidities, I think they call them, like those should actually be taken into account with the triage, even if it is like an immutable disability?
Taking
Because
into account comorbidities when triaging?
Kind of, except for like like obviously somebody who, for example, your dad had COPD. Um, what if it was not COPD but something else that like I don't know what these disabilities are off the top of my head. The article didn't really say, but Germany basically enshrined into law that you can't make triage decisions that are like biased against them based on their disability, even if it does mean that they're less likely to survive. Do you think that we should start moving in that direction to like protect disabled people, or do you think that that kind of defeats the purpose of triage? Because I've like seen it both ways in my head, and I was just curious about your thoughts.
I'm having difficulty understand. Like, I would have to see more of the details to kind of understand it a little bit better. If is the idea to keep disabled people out of the hospital more, to where they would be less likely to come into contact with COVID? Is that what this is suggesting?
No, it's not. They can't be denied treatment for like, even if it's going to make them less receptive to treatment. If it's like what is making them less receptive to treatment is related to their disability, like you can't discriminate based on that. Even in the name of triage is basically what they've said.
Oh, okay. I think I understand. Basically saying that their disability status shouldn't affect how they're triaged.
Correct.
I think, to an extent, with the exception of comorbidities, which are taken into account in triage, because that is something that can affect people's survivability and how severe someone can be. I think that's something that's already taken into account in the U.S. I would have to look into it, and I don't even know where I would start. But I'm pretty sure that that is not considered in triage, because if you're somebody who had a spinal injury or a brain injury, you come in a wheelchair with severe COVID, I don't think they're going to take that into account as much as, how are your lungs doing? How can we fight the clots? What's the current condition of the patient? As is, what's their survivability? What treatment do they specifically need? What's our availability of beds? What's our availability of ventilators? And what's our availability of treatments? Things like that. I don't think, off the top of my head, that that is something that is considered currently in the U.S.
Excellent. Yeah. I don't know. I was glad to see that they had a law that was moving in that direction, because that was my
Yeah, it sounds pretty legit, honestly. Good for them.
biggest concern with like looking at this. But yeah, I will let you go. I'm sure that you've got stuff to do with like the baby or stream to finish up or whatever it is. But I appreciate you taking the time to talk to me, and I sorry if I was a little bit contentious on Twitter the other day.
Holidays it's Twitter.
Are not fun, and also Twitter's Twitter. So
yeah, holidays and Twitter. Tensions run high. I get it. I'm glad I talked to you. I was worried at first. This turned out really good, and I appreciate it. And baby's at the babysitter's. My wife dropped him off because she was going to be out of town, and she wanted me to be able to like concentrate. So no worries there. I just didn't know if you had something to do. I do have some like other content that I was just gonna kind of look into in addition to and hang out a little bit, but I don't know. I think the conversation honestly has reached a good conclusion, anyways. So if you have any other questions you want to hit me up about this type of stuff, I'll answer it to the best of my ability.
Yeah, I'd appreciate that a lot. I appreciate you doing your best to like responsibly answer like to whatever level you're knowledgeable. And letting me even like pry about questions that weren't related to like what we originally agreed to talk to. I had a lot of fun.
Of course. So I appreciate conversations over debates. All right. I appreciate it, bud. Have a good day.
Yeah, have a good one, my friend.
Well, fuck yeah. That's a good conversation. I appreciated that. I got really worried based on our Twitter exchange that it was going to go a different way than it went, and I think we really hashed a lot of stuff out, gave some more understanding, and I'm happy with the way I had gone in wanting to first start off with a bare understanding of what he knew about certain medical terms, like starting from triage. I think that was a good place to start. That triage isn't this big broad thing, but a very much more narrower specific thing in regards to basically putting people in the line that can be best served for the people. We went a little all over the place, and that's why I wanted to guide it back to healthcare. But that was a good conversation. In the top 10. I really appreciated it. I'm not walking away frustrated. I'm not walking away like I was with fucking Ungovernable with my head buried in my hands because you're convinced that you can just will away poverty, which is so much nicer. It's so much better. So yeah, I appreciate that a lot. I'm glad I did it.
Hey, it's Mark and Eli. I hope you're doing well. Hope you liked the video. If you liked it, why don't you like, comment, and subscribe? My child may stop picking on me.